Welcome back to Local Doctors on Call. Today we're being joined by Dr. Cathleen McCabe. She is with Kantor Eye Associates, and also we're being joined by Ruth Carlson, who is a patient of Dr. McCabe's. And Ruth, you're going to talk all about your experience having cataract surgery.
I am. It's quite an experience, so I'm looking forward to this.
Now, when did you have your surgery?
I had my left eye done about 2 weeks ago and my right eye just last Thursday.
Excellent. And what was your experience? You went in. You want to tell us a little bit about what happened to you?
Well, it's an amazing technology, and I had learned quite a bit because of the seminar you mentioned earlier. And so that helped me to feel comfortable and confident when I went for my surgery. It's totally painless. It's you are awake, so you know what's going on. The ladies that greet you and take care of you while you're waiting for your time of surgery are just wonderful. They have such an amazing team there. And then, of course, Dr. McCabe is just the best ever. And she does everything so quick and efficiently that you hardly believe you've had surgery.
And you're coherent when this is being done? You're having conversations, the two of you?
We can, yeah. And some patients are, they're just kind of watching the light show. So a lot of times they'll see colors and shapes, but nothing distinct, nothing specific. So.
And once you were in the chair, were you nervous at all?
I was nervous before I got there for the first one. The second one is a piece of cake because you know what's going on. But as I said, the ladies are very good at making you feel at ease, and the nervousness goes away because you feel the confidence that they have.
You know, I think that we should go ahead and open up our phone lines and let people know that we are live tonight. And you may call us at 361-4675. Again, that number is 361-4675, and you may ask Dr. McCabe a question about cataract surgery or about the high-tech lens implants, and you may also ask Ruth about her experience, because it seems like she's very happy to make people feel comfortable about that. It's wonderful to hear. And so from the first time that you met Ruth, what happened? She came in and she had her eyes examined. She thought she had cataracts.
Right, so we talked about her examination, the health of her eyes. We talked a little bit about what her expectations were for her vision after surgery and what the options were once we realized that she had cataracts for improving her vision. Did she want to be dependent on her glasses, or was she interested in trying to get away from glasses if possible? Now, thankfully, Ruth has very healthy eyes, and so she had all the options available to her. And so we talked about different lens options. We have lenses today that will allow you to be glasses free. One of those lens options is called the Restore, and that's what Ruth elected to have.
Now, were both of your eyes, Ruth, were they the same? Was they both nearsighted or farsighted or combo eyes?
They were similar, but my left cataract had grown a little faster, so I guess that's why they do that one first.
Yeah, we always do the worst one first. Yeah, you got it.
And so when you were deciding which lens to put in, how did you decide which one would be the best for Ruth? What were her objectives, and why did you make that decision?
Well, we talked about whether or not you wanted to have glasses for distance or near, or whether or not you would like to be free of glasses for both of those tasks and have a range of vision. And in my recollection, when you learned that there was a way of being more independent of your glasses, you were very interested in that.
I was very interested. I find that as we age, we have to think about our later years, and the fact that someday we might be in care of some kind and not have to worry about glasses would be wonderful.
Right.
But even for right now, of course, it is wonderful. I remember the first day after surgery, waking up and looking at the alarm clock and being able to see it right away.
All right, we have a caller on the line. We have Dave on the line, and you have a question for Dr. Cathleen McCabe of Kantor Eye Associates. Hi, Dave, you're on the air.
Yeah, I have a question regarding the high-tech lens implants. Is that LASIK surgery is what you're talking about?
No, actually, the lens implants themselves have to do with replacing the natural lens, which is on the inside of the eye, and it takes the place of your cataract, the natural lens. It's an artificial implant that has power within it, so it's like putting your glasses or contact lens power in the lens itself. LASIK is actually a reshaping of the surface of the eye, of the curvature of the cornea, to achieve the same thing. After the age of 45, however, LASIK can only correct you for one distance, so it can only correct you for typically far distance. And if you're after the age of 45, you still need reading glasses. The nice thing about these implants is they can correct all different distances even as we age older than 45.
Okay, so I have very powerful reading glasses. So what you're saying is with the lens implant,
It'll take the
you
place.
can correct my reading problem.
Yes, yep, we can correct for your need for your reading aid with an implant, whereas LASIK would only correct for your distance vision.
Okay.
All right.
And normally, does hospitalization cover this procedure, or is this something that's out of most hospital insurance plans?
If you have a cataract, your insurance pays for your surgery, and it pays for a standard lens, but it does not pay for the high-tech lenses. That is something that will be out of pocket.
All right, Dave, thank you for your call. And now we have Marilyn on the line. And Marilyn, what is your question for Dr. McCabe?
Well, hello, Dr. McCabe.
Hello.
This is my question. No one has ever spoke of this before. I wanted to know, can I have my both eyes done at the same time?
That's a question that I often hear, because wouldn't it be great if we could just get rid of it all at once? However, we never do cataract surgery on the same day. And the reason for that is there's a very tiny risk of infection, and we just wouldn't put you at that risk for an elective procedure on the same day. So we do always separate the two, usually by 2 weeks, in some cases by as little as a week.
Well, that's a good one. And is this all covered by Medicare?
As long as you have a visually significant cataract, it is. So all
Visually significant
right.
means?
Well, it means that every insurance, including Medicare, sets vision guidelines. For Medicare, it's 20/50 vision.
20/50.
You have to have a cataract, you have to have that level of vision, and you have to have a complaint. In those cases, it would be covered, though.
All right, Marilyn, we want to thank you for your call, and we're going to take a little break here, and when we come back, Dr. Kathleen McCabe from Kantor Eye Associates will be back to answer more of your questions about cataracts and high-tech lenses, and also Ruth Carlson. We'll be right back.